2014 has focused on two areas for us. The first is consolidating the best aspects of our previous work programmes, but also at the same time we've extended ourselves and begun to work in new areas. One of the key aspects of this new work is that it continues to draw on those key principles that have underlined our work in the past. Evidence-informed work, collaborative work, and effective and efficient working with members of the community in Tallaght West. A key area that changed again with CDI in 2014 affected our research. Up until now, we'd done significant amount of external evaluation, looking at whether our programmes were effective and performing in the way that we designed them to. And this often involved bringing in expert researchers from outside of CDI, particularly from universities and colleges across the country. As I said, this has changed, and what we're doing now is a much more bespoke, collaborative approach to research, which still allows us to ask ourselves questions about whether our work is effective and doing what we want to do, but means that we're working much more in partnership with researchers, programmes and families as well. And this has been a really interesting experience so far in 2014. We're very excited about being involved in the overall evaluation of the ABC programme, working with the Centre for Effective Services and their programme team on this exciting evaluation. Up until now, those of us working in this area have found ourselves evaluating our own individual practice, and now we're going to be in a position to collaborate in and contribute to a national evaluation of the ABC programme, and hopefully there'll be some exciting learning ahead for us, both in terms of making that evaluation effective but also finding out how the work goes.
In 2014, the CDI board appointed a new chair, Suzanne Guerin. The Board of Management met 7 times during the year with a strong overall attendance. In addition to this, the board and the team met together, giving them time to reflect on CDI's vision and strategic direction. During 2014, a mainstreaming committee was also established in order to look at long-term solutions for docking our programmes. In late 2013, the board and CDI team made a declaration to adhere to the governance code, with an implementation of a new board handbook. This outlined regulatory and best practice requirements for board members. The governance code is now monitored on an annual basis to ensure that the principles of the code are being adhered to. Copies of our policies and procedures are available on request. Overall, CDI and its governance structures strive to be the best in its field. Our AGM is always held in the first quarter of the following year, and copies of our financial statements are available on the website.
The Antenatal to 3 initiative came about as a series of consultations with parents, service providers and early years experts. The main outcome was that although there are a number of services and supports working with families of young children, families were not always aware of them. They weren't always working together, and services didn't always know what other services did. There was also a need to reach out to families who may be living with particular issues such as mental health, domestic violence and substance misuse. As a result of this consultation, a logic model was developed with key objectives in the short and long term. These include greater awareness of services and how families can access them, improved working between agencies and strategies to identify and engage with families who have specific needs. A steering group was developed to oversee this work, including Coombe Women's Hospital, public health nursing, psychology services for families, GP practice nurses, Bernardo's, An Cosson, Tusla, South Dublin Childcare Committee and CDI. This steering group was guiding the work that ATI does. So far, ATI has collected information from existing work between agencies and how it could be improved. This data will be collected again in 18 months' time to see if the work carried out has had any impact on interagency work. This month, ATI held a speed networking event which over 60 individuals attended. This gave people an opportunity to meet each other and talk about what their services did. Service providers have requested that this is carried out again in a year's time.
2014 was a busy year for the CDF funded parent care facilitators, of PCFs as they are known. The PCFs worked with about 420 families, offering a range of formal and informal supports, with 30 parents receiving the Parents Plus course. Over 40 parents were referred to a range of agencies, with educational support, GP and counselling being the most common referrals. Over 80 children were referred to various agencies, with speech and language, GP and psychological being the most common referrals. There were 5 parent and toddler groups running with about 30 parents attending, As well as that, the PCFs hosted a variety of coffee mornings covering topics like healthy food made easy, self-care and visit from the dental nurse, public health nurse and community guards. School transition was also a part of the PCF work, with strong links made with our homeschool liaison officers. The PCFs offered a lot of one-to-one work, which was seen as great support to parents. There were some staff turnover and a few babies along the way, so congrats to them all and welcome all to the new PCFs.
Doodle Den is one of our very well established programmes, and in 2014 we continued to expand the reach of this well-proven literacy programme for children and senior infants, so 5 and 6 year old children. In August of 2014 we began working with 20 groups of children throughout a number of different counties and through different mechanisms, different structures. School completion programme is still really central to our work, but also we have community organisations and housing associations working with us, and we're beginning to see that the mechanisms for delivering this programme are multiple. So it's very exciting for all of us as we see that the programme can begin to be offered more widely through different structures and into lots of different communities where children are in need of some help with their literacy development. 2014 saw Doodle Den receive its 1,000th child, which was a great achievement for everybody. And we also launched our literacy website, www.doodleden.ie. In our discussions about the new funding with the area-based childhood programme, some of the school principals here in Tallow West were really keen that we would find a way to help families and children build on the benefits of Doodle Den. So we looked at how we could enable children and their families to continue to learn and continue to build on the really great work of the Doodle Den family. In 2014, we commissioned research, a literature review, and we engaged with a lot of people both here in Tallow West and much more widely who have real expertise and understanding about children's literacy development. And in 2015, we hope that we will have finalised a programme, that we will have it piloted and evaluated, and we will be looking forward to making that programme widely available.
With regard to the Childhood Development Initiative Speech and Language Therapy Service delivery continued to 9 preschools and 3 primary schools in the Tallow West area. We worked collaboratively with the HSE Speech and Language Therapists and also South Dublin Childcare Committee to produce this booklet, which is a resource for parents and childcare workers. And this booklet is due to be launched by South Dublin Childcare Committee in 2015. We also supported the current research that CDI are conducting into the Speech and Language Therapy Service in Tallow West, and this research is being carried out by Professor Noreen Hayes. We provided 2 student placements to speech and language therapists in training from Trinity College Dublin. Here we are with Conor, who is a past client of the Speech and Language Therapy Service, and he's going to help me out with some of the numbers. Okay?
136.
New referrals were received.
1,242.
Therapy sessions were offered.
13.
Coffee mornings were held for parents. And
2.
staff trainings were also held.
In 2014, one of the very exciting pieces of work that began for us was the FIP Programme, the Families Imprisonment Parenting Programme. And this is a really innovative piece of work which began when the Irish Penal Reform Trust contacted us and invited us to enter a partnership with them to look at how we can improve parenting amongst the prison population. We were really excited about it for 2 reasons. It totally fits with the prevention and early intervention message, because 1 in 6 children who have a parent in prison will end up in prison themselves. So we can intervene by improving the relationships between parents and those children. And really crucially, The relationship that prisoners have with their family is the key indicator of whether or not they'll return to prison. So by improving the relationship between prisoners and their children and partners, we can really significantly decrease the likelihood of them coming back to prison. So that's really good for all of us. We are now working very closely with the Irish Prison Service, particularly in Limerick Prison, and with Bedford Row, which is a community organisation in Limerick, and the Parents Plus programme with John Sharry. And this is going to be a very exciting piece of work which we're looking forward to in the year ahead.
We have a group of restorative trainers that meet regularly and we come together to discuss training to deliver within the community, and we deliver this training to youth groups, youth leaders, parents, teachers and anyone else that needs this training within West Halla. Myself, along with the other trainers, have come together and we're working on a piece to be able to deliver train-the-trainers training to anybody that would like to be a trainer in West Halla, so we can become more sustainable as we move into the future. The 3 schools in West Halla were given their restorative flag in Knockmore, which is in Talla West.
In addition, training for parents in restorative practice was delivered, and more schools and services are working towards being launched as restorative in the year ahead. At a national level, CDI continued to work with lots of our partners, north and south. We launched an implementation guide and a quality assurance framework, which will be disseminated across the country in the year ahead. We will also be progressing plans to develop further accreditation. And CDI continues to work with Oberstown and Wheatfield and Oakers Prison. 2014 brought both challenges and opportunities for CDI, and the challenges particularly related to the context of our work. A lot of the organisations that we work with are under pressure, under demand and under-resourced, and so enabling those organisations to really effectively engage with us in our consultation processes and our ongoing monitoring of services is an ongoing challenge for all of us. Another challenge clearly was that we are in a different structure, different funding mechanism, and so there are new things that we're working out. But as is so very often the case, that challenge is also an opportunity, and so we really welcome the fact that we have new partners, new colleagues to work with, a kind of new family of the ABC community, and also that the funding that we now have has enabled us to identify some new areas that we can begin to respond to, and obviously that's good news for us all here in Talla West and beyond.